in the context of discussing a problem, we need to ask the patient a number of questions so we can get a full understanding of what's going on, and so we can figure out with the patient what we should do, what interventions we should use. So a client might come in and say, I remember I was working with a depressed woman, and she was having a lot of problems. One of her biggest problems was that she was just spending most of the time sitting on the couch. She was having a hard time getting out of bed. She was eventually getting into the shower and getting dressed, but she hardly went out at all during the day. She was spending a lot of time very inactive and a lot of avoidance. So I asked her when the problem was the worst, and she said, well, usually it was really started after breakfast. And I asked her to think of a specific time when she was sitting on the couch. For example, was this going on yesterday after breakfast? And she said yes. And so I said, can you put yourself back in that situation? So you're sitting on the couch, and Mary, what's going through your mind? I needed to find out what kind of thoughts she was having that were leading her to feel even worse than she needed to, and was leading to this behavior which certainly wasn't helpful for her and wasn't leading her toward her goals. Mm-hmm. So I'm always conceptualizing, so what specifically is the problem? What kind of thoughts is the patient having? And how do those thoughts influence not only how she feels, but also how she behaves? And then I have to use this conceptualization and ask Mary, where do you think we should start working? So we can do some problem solving about what you could do immediately after breakfast, for example, instead of going right to the couch.